One moment, you think the bleeding has stopped after childbirth. Just for you to wake up the next morning and you notice the sudden gush from your vaginal into your underwear. And you're like, not again, not again, not again. I thought it was all done. Good day, everyone, and welcome back to Nurse's Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, we are going to be talking about that bleeding after childbirth. Yes, you are thinking, oh, I thought it stopped, but now it has started again. I'm going to be explaining why. But before I talk about that, we're going to be talking about the different types of bleeding you are going to be seeing, which we call the stages of Lochia. And I'm still going to be telling you when to rush and see the doctor, the signs that you will see that will make you to contact your doctor as soon as possible. So the first question is, what is this vaginal bleeding after childbirth? In medical term, it is known as Lochia. Lochia. You can see the spelling on the board. I'm not really an English student, okay? But it's known as Lochia or Lochia. Yeah, that is what we call it. So Lochia is a vaginal discharge. It's a discharge after birth. A vaginal discharge after birth that is made up of blood, mucus, and uterine tissue. It has this musty smell that is similar to that of your menstrual bleeding. Okay, so Lochia has different stages after birth. In terms of the stages of Lochia, we have three stages. Like I said, we have Lochia rubra, Lochia serosa, and Lochia alba. Before I start explaining what to expect in these stages, I want you to know that every person is different. But Lochia just followed this kind of progression. At the very beginning, it's usually heavy, bright red blood, something like that. But as time goes on, it decreases in quantity and the quality of blood. Let's put it that way. Okay, so now let's explain what you're expected to see in this different stage. First of all, let's talk about the Lochia rubra. In Lochia rubra, it usually flows like heavy period. When you say, oh, she's having a heavy period, that is what Lochia rubra looks like. And also it lasts between 3 to 4 days. That heavy period you see, it lasts between 3 to 4 days. And sometimes you might see some little clots in the pad. You might see some little clots in the pad, and you might experience some mild period cramping. Those cramps you used to feel during your period, that's what you experience during these 3 to 4 days, which is the Lochia rubra phase. And also, the color of the blood is actually dark or bright red. That is the first 3 to 4 days you're expected to experience that Lochia rubra phase, and this is what you're expected to see. Now let's go to the second phase, which is the Lochia serosa. In terms of the Lochia serosa, it is pinkish brown with less blood, and it is more watery. The flow is usually moderate, unlike the Lochia rubra that is like heavy period. But for Lochia serosa, the flow is moderate, and this particular stage occurs between day 4 to 12, between 4 to 12 days. In this Lochia serosa, you have little clots or no clots. You may not even see any clots between that 4 to 12 days, but even if you have, it's going to be very little and it's normal. And the last one is Lochia alba. And in terms of Lochia alba, you have this yellowish, whitish discharge. You have little to no blood, like little to no blood. You can see the spotting in it. Then also it lasts between 12 days to 6 weeks. It's more or less like the longest of them all. You are not expected to see blood clots during this process again. You are not expected to be bleeding heavily during this process. And for those asking, if I'm seeing these discharges, can I get pregnant? Yes. And it's possible for you to get pregnant. Yes. Why seeing that's Lochia, and it's possible for you to get pregnant because you can return back to fertility few weeks after giving birth, especially when you are not exclusively breastfeeding your baby. The question is, why does it stop and start again? Though there are a few reasons why this happened, but these are just few of the causes. Like, these are just the likely causes. Before I tell you the likely causes, I want to let you know that it's normal, okay? It happened to most of the women that have given birth. So it might be as a result of that extra blood flow you get when you wake up in the morning. So it's normal. It can be as a result of some exercise, some vigorous exercise you're doing. You are doing too much of that exercise, which generally, your midwife will encourage you to do some postpartum exercise to help with recovery. It can be as a result of that exercise. And it can also be as a result of breastfeeding, which stimulates your uterus to actually contract and you get that blood coming out. So one thing I want you to know in general, it's normal for it to stop and all of a sudden you see blood again. It's like it takes 6 weeks for it to totally go away. So if we did that 6 weeks, it's coming, it's going, you are not seeing blood clot, you are not having fever, then it's not something for you to be worried about. Okay, that now takes me to when to see the doctor. So on this part of the video, I'm going to be sharing with you 8 reasons why you should call the doctor after childbirth in regards to your lochia. All right. Generally, lochia usually goes on its own with time. It taper off, like from that heavy discharge to little or no discharge at all as time goes on. But if you notice these signs I'm going to be sharing with you, kindly see the doctor and get an appointment as soon as possible. So the first one is if you notice any greenish discharge. This greenish discharge is likely going to signify infection. Then if you notice a very, very bad smell, we know it smells like normal menses. Your lochia smells like normal menses. But if you notice a very offensive smell, like a foul smell, that might signify infection. That might signify that there's an infection down there that needs to be treated. Then if you notice excessive bleeding or discharges from your vagina, that is something you should call the doctor, especially bleeding. If you know you are bleeding more than normal, you are seeing a lot of blood clots, kindly call your doctor as soon as possible. If you're having fever like you're having increase in body temperature, kindly let your doctor know. If you're having swelling around your vaginal area that doesn't go down, especially when you have a tear or you had an episiotomy done, it is very, very important for you to contact your doctor as soon as possible. Then if you're having excessive or severe pain, pelvic pain, back pain, around that area, the down part, kindly call the doctor. It might be something that requires urgent medical attention. Then the 7th point, if you're having large clots, large blood clots, kindly call the doctor. At the very beginning, a small amount of blood clot is expected. Okay, but as time goes on, it tapers off, and you're no longer expected to see that blood clot again, especially at the last stage, which is Serosa alba. But if you now start seeing blood clots, call the doctor. If you are feeling dizzy, tired, fainting, call the doctor, because dizziness, tiredness might be sign of low hemoglobin, might be sign of internal bleeding that needs to be sorted out as soon as possible. Generally, if you feel unwell after giving birth, speak with your midwife or speak with your healthcare provider. See, childbirth is a whole lot on its own. So when you notice something different from normal, when you notice something abnormal, kindly speak with your doctor and don't hesitate to do that. Then the last thing I want to share with you is the care. How to care for your body when you're having this lochia, when you're having this postpartum discharge. One thing I want to let you know is personal hygiene, good personal hygiene, especially down there. You can buy this perianal vaginal bottle. It actually makes washing the vaginal after every urinary output, after going to the toilet, much easier. You can get that. Personal hygiene is very important. It's very important. Always change your pad regularly, as regular as you can. Change it. The more the pad stays for a very long period of time, the more you increase your chances of getting infected. The more you increase your chances of complications associated with lochia. And also, do not insert tampons. This is not the time. After childbirth, use the maxi pad. Use the sanitary pad. Don't insert tampons. It's not advisable, because you inserting tampons, you are just likely going to increase your chances of more infection. Then the last point I would like to share with you is wear underwear that if it happens, let it go. I can sacrifice the underwear to go, because sometimes it can be really funny and crazy. Generally, I advise disposable pants at the very first stage, the 1 and the 2, because you're having heavy bleeding. You just dispose the pants and dispose the pad. It makes life much easier depending on how your bleeding is. So disposable pants at the very beginning, it's very good. It makes life easy. But personal hygiene should not be underestimated. Buy as much pad as you can. Change as much as you can, because that is very, very important to actually prevent infection, especially when you have a tear. especially when there is a tear and the tear is healing. So if that place is smelling, most times you're not changing your pad, it can actually get those tear, those wound infected, and I know you don't like it. Anyway, thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye, and see you in our next video.